Finally, you are ready. You know you need braces and you decided to go ahead and go with it. How to prepare for your braces, what to do for the appointment. 8 tips for you to know how to keep your teeth and mouth healthy during orthodontic treatment. I'm Dr. Olga Dolghier, board-certified pediatric dentist here at Palm Valley Pediatric Dentistry and Orthodontics. So you are ready. You are tired from crooked teeth, you want to do it. So number one, what I would recommend for you is to find an orthodontist with a good reputation who actually went to orthodontic residency, because dentists and orthodontists are different. Everybody can be a dentist, but not everybody can be an orthodontist. So if you go to an office and they say, I do braces, it does not mean that they are orthodontist. Orthodontist has additional 2 to 3 years of residency training where they do only braces all day long. So the knowledge is very, very broad. They do a lot of interesting cases. Well, after you find your orthodontist you like, you want to go to your dentist, regular dentist, and check for gum disease, for cavities, to make sure that there is no problems in your mouth. So now you know you have no cavities, or you fixed all the cavities you had a great cleaning, you're all ready to go. What to expect during first appointment? Orthodontists will do an exam. They will determine what type of case you are you easy case, complicated case, and they would suggest, do you need clear retainers, which is Invisalign, or do you need traditional braces? So now let's focus on what you should do to make sure you have no cavities during orthodontic treatment. So for example, you decided to go with traditional braces like I have right now. And believe me, it's a lot of work to maintain good oral health when you have full orthodontics. So what I would suggest for you to be mentally prepared, first of all, first day when your braces are put on, you're going to be very sore. So get some ibuprofen and Tylenol and make sure you're comfortable for the first couple of days. Some orthodontists will provide a special wax. Wax is just applied on the brackets that it's not irritating for your cheeks and gums and your lips. Because when the brace is just freshly put on, everything's going to be irritated. You're going to feel like on fire in your mouth. It's not that bad, but it's uncomfortable. So after a couple of days, you will overcome that discomfort. For me personally, I use special mouthwash. The brand is Stella Life, and it's actually herbal. It doesn't have many chemicals. It just has a combination of different anti-inflammatory herbs. And I was rinsing my mouth with it. It kind of has soothing effect. So I really liked it personally. Also, you can have some home remedies, chamomile tea, for example. Just rinse your mouth after every single meal just to keep it more comfortable. Now you're gonna go shopping. You're gonna buy some yummy foods. So make sure you have plenty of supplies of soft foods like your puddings, maybe some milkshakes, maybe some nutritional protein shakes. Everything gonna be soft for the couple of days, because believe me, even biting down is sometimes uncomfortable. So soft diet for 2 days. And also, I always tell my patients before they start braces, go and eat everything you want now, before your braces are on. Because number one reason we see our patient with broken brackets is when they eat something crunchy or hard, okay? So go eat your sticky candy, go eat your crunchy crackers, everything what you want before your braces are on. Because when you have them on, you have to restrict yourself from those cravings, okay? You cannot eat Verrado or chips or Cheetos, because you're gonna either break the bracket or you're gonna get a cavity, because those are not good for your teeth at all, especially with braces. So now you know what to eat during your first couple of days. Now let's talk about how to take care of your mouth. You have to brush really good. So technique I personally use, always floss before you brush. The super floss is one of the best ones. It has like a puffy side of it, and it has a very pointy end, so I can use my pointy end to go in between, so I don't have to use floss shredders, and then I can floss in between every single spot in between my contacts inside my mouth. If you have bigger contacts, there is a special brush. It looks like a small Christmas tree brush, almost look like pipe cleaners, but very small ones, pipe cleaners. And then you're gonna go with your regular brush. Sometimes electric toothbrush, I feel like it has more rotation forces and kind of cleans out better. And also, some dentists and orthodontists recommend water pick. I personally not a big fan of water picks because it's so messy. I'm a very organized person, so it makes mess over my counter. So I don't like water picks, but some kids and some adults love water picks. Nothing wrong with them, but please make sure you still floss, because water picks remove food particles, does not remove sticky plaque. So you have to floss. Also, some toothpaste can come with disclosing chemicals in it. So sometimes we use toothpaste which actually shows us, we have this in the office, you brush and it shows you where you're missing and kind of stains your plaque. Those are very useful, especially for kids who are not a good brusher. So we can give you disclosing tablets or those toothpaste which stains the plaque. Great idea, because that way you know that one tooth I never brushed good enough. So that way you're kind of paying more attention to those areas which you didn't brush well. So this is all about what to do for first couple of days and then oral hygiene during your entire treatment, how to make it comfortable for you and what to expect. If you have experience with your own braces, did you struggle to brush? Was it easy for you to find a provider? Let me know, share below. I can't wait for your comments. Thank you so much for watching.